Hey, this is Dr. Story. I had a really interesting case recently of a gentleman who came in, and when he walked in, he literally was walking like Frankenstein with one leg. He could not move his knee at all. What ended up happening was, a couple days prior to that, he was trying to stop a volleyball from rolling, and his knee felt a little funny, and then it took about a day and a half before the swelling really started. And when he came in, he could not move his knee. We sent him out for x-rays, and what ended up happening was, this is just a plastic model of a leg. This is the femur, which is the thigh bone, and this is the tibia, which is the shin bone. This, of course, is the kneecap or the patella. And what ended up happening was, you could see it on him himself when we did a thorough exam and we saw it, but it was really wild to see on an x-ray was his shin bone here, his tibia, was literally rotated like that. So his kneecap was kind of sitting into the outside of where it should be in the little groove here. So what we did was, you'll see on the video, I posted real-time video of us doing treatment. Initially, what we were only able to do was just to traction the knee and try to rotate it back. That was successful enough for us to get him to be able to bend the knee about 90 degrees. After a couple more treatments of that, we were able to get the knee at 90 degrees, grab the back of the tibia itself and then traction it and fully rotate it. And it really, you could tell when you did that, it felt like it released the pressure in the knee, and he was able to get full range of motion of the kneecap. You'll also see me doing adjustments to the patella itself, or the kneecap. I'm actually taking the patella, lifting it up off the knee, and then bringing it and rotating it to try to get pressure off that area. This was a very successful case. It didn't take long at all, but it just highlights that chiropractors that do extremity work are able to adjust the knee and achieve really good success in these particular cases. So I hope you enjoy the video, and also if you have questions, just feel free to ask me, give me a call. What I'm going to do is I'm going to just take my thumbs, I'm going to tilt the kneecap, bring this up, and then move the kneecap. And what I'm actually doing, I'm stretching the soft tissue of the outside part of the kneecap that causes it. Now what I'm doing to his quad, again, is I'm just feeling, I know exactly what normal muscle feels like. And it actually feels like, the best description I can give you is, it feels literally like raw steak. Like if you ever took a steak and actually just kind of palpated the actual red meat. That's what we look like in here. And it actually feels normal. And then all of a sudden, when you get to an area that doesn't feel normal, it's almost like someone put a gristle piece of meat in there or something. It just doesn't feel right. And then when you do certain techniques to it, actually it almost melts away. So I'm just going to keep it at about 90 degrees, just kind of let it relax. Okay. Okay. So I'm going to go right to there. And then what I'm going to do is I'm just going to traction it, just like this. Okay. Is that uncomfortable?
Oh, no.
Okay. A little differently, you're going to use your force. You're going to try to rotate out.
Okay.
I'm going to be rotating the tibia this way, and we'll get a torque right there. So go ahead and do that. Okay, relax. Okay, let it get straight. I'm going to traction it. Okay, go ahead and turn. Okay, good. So what I'm doing is he's going to be trying to rotate the femur in that direction, in an anti-clockwise direction. And what I'm doing is I'm grabbing the tibia and I'm rotating in a clockwise direction, so we get a torque there. So it's a way of doing adjustment. And I'm also tractioning it. So let me traction it first. Okay, go ahead and rotate. There we go. Let it relax. Did you feel that grinding in there when we just did that? You didn't feel that?
No.
Okay. Okay.